Hello everybody, this is Dr. Kamen with Apex Chiropractic, and today I want to put out a video for you guys detailing how we go through each individual adjustment in our office and the different ways that we can perform adjustments. So let's dive right in. Alright everybody, so today we have our volunteer, Claire, volunteer patient. She's going to be helping us to show and demonstrate how we perform adjustments. So we're going to get started. Claire, I'm going to have you lay face down on the table. Okay, so a couple of things that happened before Claire even laid down. She would have already signed into our computer station, and ultimately she has a face paper laying down on the table. We always do that for patient safety. She would remove glasses, wallet, keys, phone, anything else that's in her pockets, and laying face down, getting ready for adjustment and allowing her body to relax. That's the key thing here. We want you to be relaxed when you have your adjustment. So let's dive into the adjustment itself. Now, before I'm even starting to adjust, I'm going to be analyzing the spine before I even touch anything. We're going to be looking at how is the patient breathing, what areas of their body seem tight and tense, what have they told me is going on when they come into the office. I'll also look at ultimately how are their feet aligned, right? Is there any sort of a twisting in their feet and their ankles or anything that would give me information as to what they're presenting with that day, and I go over all of that up here before we even get them adjusted. But now let's start the process. So for our adjustments in our office here, we use a technique called torque release technique. Now what that means is I'm ultimately looking at each visit for where there is the most nerve tension and nerve irritation in the body. And then we make specific chiropractic adjustments based on where that nerve tension is. So let's dive in. What we're going to do here is we're going to check her ankle reflexes here, her Achilles tendon reflexes. So we'll go ahead and do that now. That gives us a lot of information as to where there's nerve tension in the body. So we'll go ahead and activate those reflexes. All right, Claire, I'm going to have you turn your head to your right side for me. There we go. Activate those reflexes again. We've gained a little more information. Turn your head to the left. There we go. All right, now I'm going to have you go to the center. So based on her nerve reflexes, she has a little bit of tension in the neck today. So I'm going to do some pressure testing in the neck to see where there's that specific tension and irritation. So all it looks like is a little pressure test just like that. Very simple. Let me go ahead and activate that reflex. So now what we're going to go ahead and do is we're going to make an adjustment to the neck, and we're going to demonstrate two different ways of doing that here in our office. So now that we've figured out where Claire has nerve pressure in her nervous system, we're going to go ahead and make an adjustment. So she's laying on her back, face up. We're going to make an adjustment to the neck, specifically C2. So we're going to go ahead here and make that adjustment. Now ultimately, a lot of people tend to think about twisting, cracking, and popping. It's very violent, it's very rough, but our adjustments are very gentle. It doesn't take much pressure to make a chiropractic adjustment. So here, we're going to go ahead and make an adjustment. I always tell people sometimes to take a deep breath in, go deeper in, let it all the way out. Okay. Very good. All right, everybody, so now we have made an adjustment to the neck. Now we're going to go ahead and take a look at the nerve pressure and any nerve tension that might be existing in the low back. So let's do that now. We're going to go ahead now and activate those Achilles reflexes there. We're going to do some pressure testing near the sacrum or your tailbone, and we're just going to be checking for where there's the most tension and irritation in the low back. So this is all a process. Every single time you get adjusted, it's not the same thing over and over and over. We're really truly trying to look at where there's specific tension on that visit so we can give you specific tailored care to you. So what we're going to go ahead and do here is just a couple other checks here as well, just to see where there might be some additional tension in the low back. And based on what I'm finding, we're going to make an adjustment to the sacrum here. So how we're going to be doing that is through a drop table. And what a drop table is we go ahead and perform the adjustment using the table, right? So the table will literally drop away as we make the adjustment. So I'll demonstrate that here. So we're going to go ahead, make our contact here with the sacrum where there's the nerve pressure. We're going to go ahead and elevate the table, and it's going to swing away. So we do that 3 times, and ultimately it's very gentle, very light for the patient. Right, it was pretty light, Claire? Okay, very good. So now we're going to continue our analysis here and figuring out other areas where we may need to make adjustments based on what her nervous system is telling us. And I'm picking up a little bit of nerve pressure here on the right pelvis. We're going to go ahead and make those some similar but different adjustments here using the drop table. So we'll make our contact here. Okay, now Claire, I'm going to have you turn your head to your right side for me. Good, and to the left side. All right, go to the center. Okay, we're continuing to look and evaluate for more nerve tension. And so what we do occasionally for practice members is about 50% of our practice members actually get adjusted utilizing an instrument only. Now, there's certain adjustments that we'll do with an instrument. Some people get adjusted only with instrument, but we're going to go ahead and show that adjustment to you here today. So how do we do that? Well, we go ahead and we load the instrument like so. There we go. Now we're going to go ahead and make an adjustment up in the neck. So Claire, what I'm going to have you go ahead and do is if you can take a nice deep breath in for me. Good, let that all the way out through the mouth. Okay, very good, very light, very gentle, very effective. And now at this point, we're going to just post-check everything, make sure our nervous system is clear. Claire, I'll have you turn your head to your right side. Good, and to the left side. Go to the center. All right, and her nervous system's clear. So that means that we're done adjusting, we've done what we need to do at that visit, and ultimately she's ready to go about her business. And in total, that time of getting adjusted is around anywhere from 2 to 4 minutes, depending on what needs to be adjusted that day and maybe how you prefer to get adjusted. So between all of those things, again, our goal here at Apex Chiropractic is to help you function better through specific neurologically based chiropractic care. And ultimately, I want to be able to show that to you today. So thank you for tuning in. We really appreciate it. If you have any questions, go ahead and give us a call or click the link above to make an appointment for you or a loved one. Thanks, guys, and have a great day.